and welcome to my video, Knoll's Adult Learning Theory on Andragogy. I am Bonnie Moon, and this is for my DNPU Course 705 for Brandman University. What is the adult learning theory? Well, the term andragogy literally means man leading. So pedagogy was the first original Greek term that meant leading a child or teaching a child. So literally this is the reverse and just for adults. So adult learning is the definition. And Malcolm Shepard Knowles used andragogy for the adult learning theory, and he was an American educator. So Knowles has 5 assumptions for the adult learning theory. Basically, adult learners have the self-concept assumption, which means that they will become less dependent and more independent on their decisions because they have experiences. And so the adult learner experience ties in with that, where based on your experiences and your knowledge will be your level of learning, and your readiness to learn is based on your experiences and in your life and what tools you have based on the life you've lived to learn. And your orientation to learning is your perspective currently in life that would affect the centeredness of your problem on and how you view it, and your motivation to learn as you mature. It becomes more internal, and instead of being told what to do. There are 4 principles of andragogy. So adults need to be involved in their planning, their education, their evaluation, and their experience based off their mistakes. It gives them the basis for their learning activities, and the relevance and impact to learners has an immediate impact to their job or personal life. And adult learning is a problem-centered rather than content-oriented. So I used the adult learning behavior theory in my CSP because I'm using the 5 A's framework to counsel obese patients, which is a motivational behavior change intervention. And so if I want to motivate obese adults to learn, then this would be a great theory to you because it's motivational. So when you combine the adult learning theory and the 5 A's framework, their relationship is this. For the first theory, which is self-directed autonomous, and combining it with the assessment part, where you're assessing for the risk and readiness for change, basically the primary care provider will promote patient autonomy as they assess the person's readiness for change. The collaborative engagement allows a thorough assessment. So if you are utilizing knowledge and life experiences when advising behavioral changes, you're really allowing the patient to input their conversation, enable them to self-reflect, and realize their areas for improvement. And in order to be goal-oriented when you are agreeing on specific goals, you're really allowing the patient to verbalize their goals, to lose weight, and the primary care provider should determine if they're reasonable, and then you agree together and the provider directs it. And to be relevancy oriented when assisting in assessing and addressing their needs, you're going to do motivational interviewing, and that will help them verbalize their reason for wanting to lose weight, which is much better than you telling them. And once the patient identifies their reason for improvement, they can then address and identify their barriers that might impede their plan, and that's when you come in and assist in filling in the blanks and helping them get to those needs. In order to highlight practicality to arrange any plans, you want to understand the reasons for change, goals, and barriers. And if the patient understands it, the PCP can collaborate with the patient on measures that promote positive outcomes. And the plan can be reevaluated during the office visits and determine if it needs to be readvised or if they need a referral. And that's the best way to reach your positive outcomes, is to encourage this. Thank you for listening, and my references are on the next slide. And last